Hello, my name is Kimberly Waynes. I'll be narrating this educational video on behalf of Western Allergy. We would like to thank the American Academy of Allergy, Asthma, and Immunology for granting us the permission to use the following information. So let's talk about allergy shots, also known as allergen immunotherapy. This is a long-term treatment that helps reduce symptoms for people with allergic rhinitis, allergic asthma, eye allergies, or even stinging insect allergies. Over time, it decreases sensitivity to allergens and can provide lasting relief even after treatment stops. Pretty great, right? Now, who can get allergy shots? Both kids and adults can benefit, but they're usually not recommended for children under 5. Younger kids might struggle with the routine of allergy shots and communicating any side effects. For older adults, existing medical conditions such as heart disease should be considered before starting treatment. Deciding whether allergy shots are right for you depends on a few things: how long your allergy season lasts, how severe your symptoms are, whether medications or environmental changes are helping, if you want to avoid long-term medications, and whether you can commit to the treatment schedule. Speaking of commitment, let's talk about how allergy shots work. Introducing small amounts of an allergen into your system to build up tolerance. There are 2 phases, the build-up phase and the maintenance phase. The build-up phase is when you get injections with increasing doses of allergens about once or twice a week for 3 to 6 months. The maintenance phase starts once you reach an effective dose, and at this stage, shots are spaced out every 2 to 4 weeks or once a month and can continue for 3 to 5 years. You might notice some symptom relief during the build-up phase, but it can take up to a year on maintenance doses to see significant improvement. So are allergy shots actually effective? For many people, yes. They can even prevent new allergies from forming, and in kids, they might stop allergens from developing into asthma. The success of treatment depends on the dose, how long you stick with it, and environmental factors. Some people get long-term relief, while others may see their symptoms return after stopping. If the shots don't seem to work, it could be due to a few reasons. Maybe the dose isn't high enough, an allergen was missed in testing, or exposure to allergens and non-allergic triggers like smoke is too high. Where should you get allergy shots? Always in a doctor's office, preferably with an allergist, but if that's not possible, another doctor such as your GP can administer them, but they'll need clear instructions. Since reactions can happen, it's best to be in a medical setting. Now, what about side effects? The most common reaction is redness or swelling at the injection site, which can happen right away or a few hours later. Some people might experience allergy-like symptoms such as sneezing or congestion. Serious reactions like anaphylaxis are rare, but require immediate medical attention. That's why it's recommended to wait in the doctor's office for at least 30 minutes after getting a shot. So in summary, allergy shots can be an effective long-term treatment, but they require patience and commitment. If you're considering them, talk to an allergist and see if it's the right choice for you. Thank you again to Western Allergy for providing the funding for this video, and the American Academy of Allergy, Asthma, and Immunology for allowing us to use the content.